As we all know, arthritis is one of the most common musculoskeletal conditions, and many of my patients ask me, what can I do to decrease my odds of making this worse or decrease the chance that I end up with a joint replacement? And that's kind of a tough question in 2023, 2024. Right now, we know about 70% of wear and tear is genetics. I typically will say that 25% is how long you've been here, what you've done while here, what injuries you've had. And there's certainly a portion out there that we don't know yet. There's all sorts of things that are all around us that may be contributing to this, and we are certainly seeing the rates of arthritis go up. There are a few things that are absolutes that you can do to decrease your risk. And so with knees, there's certain activities that are more harmful on your knees, such as squats, lunges, activities where your knee is bent. For the hip, it's sort of the same thing. The hip doesn't take on as much pressure as the knee. But for now, genetics probably plays the biggest role. Injuries play a role. And then we do know that obesity plays a role in increasing the risk of arthritis. So proper weight management does play a role in decreasing your risk of further arthritis or damaging your joints. Now, many of my patients ask me about supplements or certain diets. And I think it is important to consider these, but they are very small things that play a role in whether or not you're going to wear your joint out. But all the time I tell patients that blueberries and turmeric are antioxidants that decrease joint inflammation. There is some evidence that high-fat, high-sugar diets plays a role in joint inflammation. And so proper diet can play a role, but again, it's probably not going to be the end-all, be-all difference between you having a joint replacement or not.